Hello, Blazers. Welcome to episode 147 of UAB Green and Told, original release Monday, April 7th, 2025. Our podcast allows us the opportunity to share stories from members of the UAB community. Check out all the previous episodes of the campus's most listened to podcast by visiting alumni.uab.edu/greenandtold on Spotify or the Apple Podcast app. And while you're there, leave a written review so more alums can listen in. I'm Greg Berry, a UAB alum and Director of Communications in the Office of Alumni Affairs. In this episode, we're chatting with Lieutenant Bekah Sutter, whose career path has been anything but straightforward. Navigating the twist and turn of her journey, Bekah's story is one of remarkable adaptability, including the unexpected route she took into public health.
While I was in my career, I didn't feel as fulfilled or impactful in my career as I kind of hoped to be. And I had no idea what I wanted to do next. I just knew I wanted to do something different.
Despite knowing little about UAB or Alabama for that matter, she took a leap of faith and launched into her learning journey.
So I knew that it was a good school that I was going to get a good education from. But aside from that, I didn't really know anything about Alabama, anything about Blazers, UAB, anything like that.
And now as a disease detective, she diligently defends public health.
One of the big things for people to remember is that there are people working behind the scenes to learn more about them and figure out ways that we can reduce the spread of these diseases and keep people safe and healthy.
As a full-time, fully online student, Lieutenant Bekah Sutter's UAB experience is as unique as her career journey. Initially, she began in nursing, but soon discovered her true calling in public health. Today, she leverages her background and passion to protect public health as a disease detective, a role that isn't too surprising given her upbringing in a relatively rural area near Columbus, Ohio.
I grew up in the country, so played in the woods a lot. In school, science was always my favorite subject, so loved animals. Yeah, I don't know. I guess I haven't really thought too much about what I was like as a kid, so that's an interesting question.
When it comes to science, what drew you to science? Why the interest there?
That's a really good question, and I don't know that I can pinpoint an exact answer for you. It's pretty much always been my favorite subject in school. I just find it really fascinating, and I love the variety of it. There's so many different topics to explore and things to learn, and it's really never ending, the learning that you can do in science. So yeah, I don't know if there's necessarily like one specific thing. I don't necessarily have this mentor or somebody who really got me started in science. It's just always been an area that I've been interested in.
Was there something that led you down your career path that you're currently on?
My career path was, I don't know if bumpy is the right word, but definitely not straightforward. I think if you would have asked me 10 years ago told me that I would end up in public health 10 years ago, I probably wouldn't believe you. So I actually started my career in nursing. And I did that primarily, again, just because it had topics that I was interested in. I was interested in medicine, pharmacology, biology, anatomy, all of those things, and it kind of combined all of that. I actually had two older sisters who were also nurses, and watching them go through nursing school, I told myself, absolutely not, I will not be a nurse. And then lo and behold, it kind of fit the things that I was interested in. So I ended up becoming a nurse. And while I was in my career, I didn't feel as fulfilled or impactful in my career as I kind of hoped to be. And I had no idea what I wanted to do next. I just knew I wanted to do something different. And I really didn't know much of anything about public health. It was very minimally taught in nursing school, and what we did learn wasn't really the full scope of public health.
Okay.
So I just kind of started looking into different things that I knew and was familiar with, and one of those things was nurse practitioner school. So I started a nurse practitioner program, and as fate would have it, my very first course was epidemiology, and everything just clicked. I knew pretty quickly that that was the type of work that I found really interesting and that I really wanted to do. These weren't terms I necessarily knew at the time, but I was really drawn to the systemic and preventative approach to healthcare, opposed to what I was doing in the hospital. So I ended up not finishing my nurse practitioner program, and I decided to start looking into jobs in public health. And I found a local health department that was hiring, and I started working there and knew that that was definitely the career path I wanted to be on. So then later led me into an MPH program at UAB.
What was it about epidemiology that kind of clicked? You said that and used that term click. So what was
Yeah.
it?
Yeah, I think several things. One, like I said, it was kind of a more systemic approach. So working in the hospital and healthcare, I was in the ICU specifically. So working with one or two patients at a time, which is great. And nurses are obviously in that capacity amazing and do amazing work. But for me, it felt like I wasn't doing as much as I felt like I could be doing. And I think that public health offers that kind of systemic approach where we can make changes on a bigger level than you can when you're working one-on-one individually with patients. The other thing is the preventative approach, kind of catching people before they're all the way in where I was in critical care, hopefully helping them not get to that point, hopefully helping them not get sick at all. And if they do, ideally catching it sooner than that. I think just in terms of my personality and interests, I also really like the kind of detective work, if you will, of it and being more investigative. And I really like problem solving. So I think the approach to health that it takes and the outcomes that we hope to achieve in epidemiology and public health really just align with my goals and my personality and my interests.
You have a completely different perspective of your UAB experience than I would say probably 99.9, if not 100% of my guests, where you were completely an online student.
Yes.
When you were looking for MPH programs, what were you looking for and why ultimately did you pick UAB?
There were a variety of factors that I was looking at when I was looking for an MPH program. As I mentioned, I had started working at a local health department, and that had kind of set me off on my career trajectory, knowing what I wanted to do and that I wanted to continue in that path. So I knew I needed an MPH, and I wanted to continue pursuing epidemiology. So I knew I wanted a concentration in epidemiology. So that right there kind of narrowed it down school-wise. But then there were also a variety of other factors, including I was working full-time at the time when I was applying and when I first started the program. So I knew I needed flexibility, and particularly a program that I could do asynchronously, so I could do it outside of working hours. I also, as I mentioned, liked that I could get a concentration in epidemiology, but I was also very interested in global health. And UAB offered the opportunity to get a graduate certificate in global health. And then aside from that, I was also just looking for affordability and quality of education and kind of the combination of those. So all of those factors just lined up, and UAB was the one.
As somebody from the Great Lakes region, the Midwest,
Mhm.
being Ohio, what did you know about UAB when you're going through the search? Did you know anything?
I didn't know anything other than kind of those factors that I just mentioned that I was looking for in a school. I did a lot of searching, looking at, school rankings and, different websites that talk about the quality of the education. And so I knew that it was a good school that I was going to get a good education from. But aside from that, I didn't really know anything about Alabama, anything about Blazers, UAB, anything like that.
What was the MPH program like?
It was great. It honestly gave me all of those things that I was looking for in an MPH program. It felt I can't remember exactly my class sizes, but it felt relatively small. I felt like even as an online student, I was still able to make personal connections with my professors, which was fantastic. It was a really great program, and it gave me everything that I was looking for and everything that I needed. And I even still reference my course material from time to time. So it was great.
Have you ever been to Alabama? Did you finally, upon graduation, come?
On graduation, that was my first and only time on campus, was for graduation.
What'd you think?
I loved it. It was great. Campus is really cool. I love the dragons everywhere. Got lots of good pictures. It seems like it would have been really fun to attend in person, but obviously I didn't have that opportunity.
So how did that online course, the online MPH program, help kind of set your career down a different path to where you are today?
Well, I think being able to concentrate in epidemiology and get that global health certificate has been really important for me. I haven't had the opportunity to do a lot of global health work, but it's still something that I'm interested in. And I think especially going forward in my career, being able to have that background in have that certificate is really important. And that's not something that a lot of schools offer, especially both of those topic areas. So, and then also being able to be online allowed me to keep working and keep getting experience in different areas of public health as well. So it was great.
You have done very well in the first stages of your career, and I don't want to say you're a rock star, but you've risen. So what do you attribute that rise in your profession to?
I think there's a couple things. One is being willing to explore different opportunities. When I was in nursing school, and then when I started nursing, as I mentioned, I really didn't know much of anything about public health. And then when I decided that was an area I wanted to pursue and was interested in, I just started looking for jobs in my local area that were public health related. And so being able to kind of take that leap of faith into a world that I knew nothing about. I had never worked in an office, for example, 5 days a week, Monday through Friday in an office. I was a waitress in college, and then I worked as a bedside nurse. So we did 12 hours in a hospital unit. So that was a big step for me to work 5 days a week in an office. So just being willing to explore different opportunities that are interesting and step out of your comfort zone, or my comfort zone, I think was a big part of that. I think with EIS, my current program specifically, not counting myself out. Most of the people in my class have terminal degrees, and I don't. I'm a nurse with an MPH. And so I thought getting in was a long shot, but I was going to try it anyway. And I did, and here I am. So I think just being open to new opportunities, and also putting your name in the hat, even if you don't necessarily feel like you're a shoo-in, if you will.
You used the word detective a little bit ago. I want to explore that a little bit. What's it like being a disease detective? What do you do? What is that all about?
Yeah, so EIS is the Epidemic Intelligence Service, and that's the current program that I'm in. We're often referred to as disease detectives. We serve on the front lines of public health in a service learning program. Okay. So we are working and learning alongside subject matter experts in their field, which is phenomenal. And also being kind of this front line, we respond to emerging public health threats or outbreaks and things like that as these disease detectives, kind of figuring out how we can stop the spread of disease, where it's coming from, all of that.
Your work has led you to working kind of with bugs in a way. Talk about your work on the West Nile virus and other diseases, and what you're doing to kind of better the global health system.
Yeah, so I work on the surveillance and epidemiology team for the arboviral diseases branch. And arboviral diseases are diseases that are primarily viruses specifically that are primarily transmitted through mosquitoes and ticks. So as you mentioned, things like West Nile virus, other ones that people commonly think of, Zika, yellow fever. There's a whole bunch of them that are less common that people don't hear of as often. But on the surveillance and epidemiology team, we work primarily on the human side. So I did one day go to the lab, and they showed us how to ID mosquitoes, which was very interesting with our entomology and ecology team. But we focus on the human side of things. So a lot of it is collecting, analyzing, and interpreting data to send out to partners and the public, doing research to better understand these diseases and how we can prevent them from spreading. We also do a good bit of consulting and providing technical assistance and answering inquiries from health departments, healthcare providers, and the public just about the diseases in general, how to test for it, how to diagnose it. We don't have treatment for our diseases, but kind of talking through that and what can be done. So that's kind of our day-to-day, if you will, in a nutshell.
Looking back as a 10, 15-year-old you, did you think you'd be doing research with mosquitoes on bugs?
Oh no, I actually hate bugs. Like insects, I do not like insects at all. So just to emphasize, I work on the human side of things. We do have an entomology and ecology team that does a lot of really cool work specifically with the actual insects. So I see pictures of them. I hear about them. I understand different things about the insects, but our focus is really on the human side of things.
And that's fair enough. Definitely fair enough. So when it comes to your research, it's gotten attention. How satisfying is it to see the work that you're doing have that notoriety to it?
I think it's great. My main goal is to help limit the spread of these diseases and help prevent people from getting sick. So any way that information can get out there and spread awareness about what people can do to prevent these diseases is great. So that's what I'm most focused on, not so much having my name on things, but just helping people not get sick.
So what can people do to prevent the spread of these diseases?
That's a hard thing. Most of our diseases don't have any kind of treatment. A couple of them have vaccines, but not many. So the biggest thing that people can do is, one, just be aware of where you are and what kind of arboviruses can be spreading in that area. Wearing EPA-registered insect repellent, and then also wearing protective clothing, so primarily loose-fitting pants and shirts when you're outdoors in areas where you could be in contact with mosquitoes and ticks. And if you're in areas like tall, grassy areas that you might be coming in contact with ticks, like if you're out on a hike or camping or things like that, just making sure you're really diligent about checking yourself afterwards and removing any ticks that you might find.
How concerned should not just Americans be, but the world population about diseases like these?
That's kind of a tough question. I think one of the big things for people to remember is that there are people working behind the scenes to learn more about them and figure out ways that we can reduce the spread of these diseases and keep people safe and healthy. So just having confidence that there's people out there working on this, even if people aren't necessarily thinking about it. The other thing that I think about is that knowledge is power. And so these diseases are present, and some people can get really sick from these diseases, but as I just mentioned, there's things that you can do to help protect yourself and help prevent getting sick from these things. So just being aware of what those are, and like I said, being diligent about using your bug spray when you're out in times where you could be in contact with mosquitoes or ticks, and doing your tick checks and wearing protective clothing. Like for me personally, I love outdoor activities. I live in Colorado. I love hiking and doing all kinds of outdoor things. So it doesn't stop me from doing those activities that I enjoy and getting outside. It just, working in this area has brought more awareness, and now I have bug spray in my car and I have it, by my front and back door. And so when I go outside, I put some on and then I go about my day.
As research progresses, is there going to be something that can really help prevent this even more, do you think, down the road?
That would be great. I wish I had a crystal ball and could see into the future and answer that question. But I don't know, but that would be great if there is. And I think there's people working on that kind of stuff. So
where's Bekah Sutter going to be down the road?
That's a great question. This is a temporary training program. So I'm in my second year of the 2-year program. The program ends the beginning of July 2025. So currently applying to positions. I definitely plan to stay in public health and epidemiology and continue in this work in infectious disease. I don't know that it'll necessarily be arboviral specifically, but definitely want to continue working in epidemiology and infectious disease and helping keep people from getting sick with these things.
Do you think a 15-year-old you would think you'd be in the position you're doing the things that you're doing today?
Absolutely not. I think 15-year-old me had no idea that this world even existed, this public health world. So no, I don't think I would have considered this as a possibility.
That's Lieutenant Bekah Sutter, a 2022 graduate of the School of Public Health, where she earned her Master of Public Health and a certificate in Global Health Studies. Today, she serves as an Epidemic Intelligence Services Officer with the Centers for Disease Control and Prevention and as a Lieutenant Nurse Epidemiologist with the U.S. Public Health Service. Although her time in Birmingham was brief, she has a strong understanding of what it means to be a Blazer.
I am very proud to be a Blazer. I am very grateful for the education I received through UAB. I had fantastic professors. As I mentioned, I still reference some of the coursework that I had during the time that I was in the program. So clearly they understand public health and how public health works in the real world, and tailor the coursework for that. So I'm very proud to be a Blazer and very grateful for the education I received.
Be sure to check out past episodes of the UAB Green and Told podcast. Listen in at alumni.uab.edu/Green and Told. Have a story to share or know someone who does? Email greenandtold@uab.edu. Finally, be sure to follow us on social media. Just search UAB Alumni on Facebook, Instagram, and Twitter. Thanks for listening, and until next time, go Blazers.